Merck was one of the best performing stocks on the blue chip Dow index today after the drug company's new type of lung cancer drug performed better than expected in a highly anticipated clinical trial. The stock rose about 2.5%, providing hope for patients, physicians, and investors. Meg Tirrell has the details.
Since they were approved in 2014, drugs that stimulate the immune system have been giving new hope to patients with melanoma, kidney cancer, lymphoma, and other cancers, including famously to President Jimmy Carter, who credited a drug called Keytruda with shrinking tumors that had spread to his brain. That medicine, made by drug giant Merck, showed some new results today in lung cancer that are being called unprecedented.
Very good news for people with lung cancer who desperately need some good news.
Lung cancer causes the most cancer-related deaths of any form of the disease, so better treatment options are greatly needed. The American Cancer Society estimates lung cancer will cause more than 234,000 new cases this year in the U.S. and more than 154,000 deaths. The size of the problem also means it's big business. Evercore ISI analysts say the market for lung cancer drugs is estimated at $10 billion to $15 billion a year. So the results today, presented at the American Association for Cancer Research conference in Chicago, were closely watched, both by medicine and on Wall Street. The data on Merck's Keytruda were from a clinical trial in newly diagnosed lung cancer patients whose disease had already spread. Keytruda was tested on top of standard chemotherapy. The results showed patients taking Merck's drug were half as likely to die from lung cancer than those on chemotherapy alone. Wall Street analysts had been expecting a reduction of about 30%. Merck's stock rose on the news.
I would say the advantage goes to Merck because they're going to be able to put all of this on their label.
It was a different story for competitor Bristol Myers Squibb, which also presented new clinical trial results for its immunotherapies, Opdivo and Yervoy. Those drugs in combination reduced patients' risk of death or their cancer progressing by 42% versus chemotherapy, still beating Wall Street's estimates. But it wasn't enough to satisfy Wall Street in the face of Merck's data, even though the results aren't directly comparable, as the trials were run in different sets of patients. Still, Bristol's shares fell. Merck's drug is already approved to treat advanced lung cancer patients who haven't yet tried other options, and today's clinical trial results are expected to boost prescribing among physicians. A continuing question, though, will be the medicine's cost. Both Keytruda and Opdivo have price tags of around $150,000 a year, without being combined with other therapies. Even as the field of medicine applauds better results, the side effect of financial toxicity is an increasing concern. For Nightly Business Report, I'm Meg Tirrell.